Okay, so you've got a radiology report and it says that your child has a bone tumor. Now this can be a very, very scary time. But let me tell you, most bone tumors are not serious. And in fact, most of them are not cancer or benign. There are common types of bone tumors that we frequently see, and these include osteochondroma, non-ossifying fibroma, or cysts. An osteochondroma usually presents whenever, out of the blue, or maybe it's been there for a long time, your child will say, "Mom, I've got a hard mass on my knee," or "What's this on my shoulder?" And then you get an x-ray, and the x-ray will show an outgrowth of bone and cartilage. Now this isn't particularly serious as far as cancer, but this bump won't go away. Luckily, there's a pretty simple procedure to remove it with a very short recovery. So now you have an x-ray report that says non-ossifying fibroma. This is a big word, but let me tell you, a non-ossifying fibroma is basically just the birthmark of bone. They're usually small, up to 20 to 30% of people have them, and they usually go away when a child is done growing. Sometimes though, they're large and they can weaken the bone and cause a fracture or break. And if this does occur, we have options for you. We can scoop out the fibroma, we can add in bone graft, and we can try to prevent this from being a major issue for your child. Another common type of bone tumor is a bone cyst. There are generally two types of common bone cysts. One is called a unicameral bone cyst. The other one is an aneurysmal bone cyst. And the severity of these cysts depend on how big they are, which bone they're in, and the location within the bone. Treatment can be either watching it or surgery. It can involve pulling the fluid out and putting in medicines to prevent recurrence, or scooping away the cyst, packing in some bone graft, and then sometimes the cyst is an area of the bone that needs some extra support, which we will then support with plates and screws or rods. We're really looking forward to meeting you and your child when you come for a visit.